Well, good afternoon, everybody. This is Dr. Ken Muich from the Fibromyalgia Wellness Center. I hope everybody's having an enjoyable day and a very hopefully healthy and happy weekend. And this is our 14th presentation, believe it or not, each Monday at 12:30. So I do hope you are telling your friends and so forth to join us. Not only will I be talking about a subject today, but also answering a number of notifications and questions that patients have sent out that seem to be building up more and more. I apologize if I don't get back in touch with you right away, but there's so many people that are requesting information that sometimes I can't get at all of it at the same time. So what I plan on doing is maybe covering some of these subjects during the presentation today. Okay, so today I want to talk to you about something. Back in February 12 of this year, I did a presentation on the other conditions that affect fibromyalgia and makes it so difficult as far as diagnosing fibromyalgia properly. Well, this also affects the patients in many other ways. For example, I had a patient that came in a couple of months ago, and with fibromyalgia, we did the thorough evaluation and so forth. And she was very, very strict and very, very rigid as far as that she wanted to do the overall protocol. And so what we did was we started on it. We did the very gentle pre-protocol detox. And then we went into the guaifenesin protocol, and then a follow-up that we do. And the fibromyalgia symptoms that she had, and all of the testing we were doing, the fibromyalgia symptoms were going down. They were reducing. And yet the patient was very, very frustrated because many of her aches and pains and so forth were still present. And so she kept on saying, "What's going on? I don't understand this." Well, let's go over, first of all, let's review these other conditions that mimic fibromyalgia. And I'm going to be talking about them again so you understand these things really do adversely affect you. I've always called them white smoke or secondary conditions, but they linger on during your treatment for fibromyalgia. And so I'm just going to go over with you. There's IBS, celiac disease, rheumatoid arthritis, osteoarthritis, MS, Lyme disease, lupus, migraine headaches, cluster headaches, hypothyroidism, hypoglycemia, diabetes, and Sjogren's. All of those have symptoms that mimic in one way or another fibromyalgia. So the point I'm trying to make is that, look, there's a lot of symptoms that can be classified as conditions also. For example, headache. Headache is a separate condition. Celiac disease, that's a separate condition. Or migraines, or hypothyroidism, so forth and so on. Since 1990, since I started working with fibromyalgia patients, believe it or not, there is no fibromyalgia patient that is pure fibromyalgia. Every fibromyalgia patient that we have tested and evaluated has at least one or more other conditions. Now, why is that important? Because fibromyalgia magnifies and makes all those other conditions worse, believe it or not. So, as a patient, say for example, the existing patient that we have right now is improving in fibromyalgia and chronic and all the other symptoms that she has concerning that, the other secondary conditions oftentimes will then rear up. For example, rheumatoid arthritis or hypothyroidism, so forth and so on. Now look, as we improve the fibromyalgia condition, so also will many of the other symptoms reduce or abate. But that doesn't mean that by treating fibromyalgia, your rheumatoid arthritis will disappear or your hypothyroidism will disappear. So many of the symptoms that patients have that are left over, for example, are not from fibromyalgia per se, but from these other secondary conditions. And that makes it very, very frustrating for many, many people because that thought of fibromyalgia still being there, which it's not, believe it or not. There are so many different ways that we can test the fibromyalgia from the other conditions. So yes, fibromyalgia makes everything worse. So as the fibromyalgia symptoms go down, so also do most of the other symptoms of other conditions. However, depending upon the severity of the condition, and each and every one of these I mentioned to you, the irritable bowel and the celiac disease and so forth and so on, have many times their own conditional problems. And so what we're doing is we're removing the fibromyalgia so the other conditions can be concentrated on as far as treatment and so forth. Keep that in mind. So as fibromyalgia makes all of the conditions and symptoms worse, as we remove the fibromyalgia from the patient's body, so also will many of the symptoms of the secondary conditions be reduced also. There's one other thing I want to mention here, and that's very, very important. And that is, what kind of medications are you taking, such as the side effects of medications. Because if you're still taking medications, of which most of the fibromyalgia patients come in, and they usually give me an 8.5 by 11 of the different medications, and their side effects many times mimic the symptoms of fibromyalgia. So you may wish to look at and look up, most people have computers now, look up what are the side effects of the pharmaceuticals that you're already taking. Hello, Shelley. Hi, how are you? Thank you very, very much, everybody, for joining in. So keep that in mind, that the fibromyalgia treatment is for fibromyalgia, but everybody, like I say, that has come in really has secondary conditions. Some are minimal. They can be taken care of, believe it or not, by chiropractic, osteoarthritic conditions, so forth. They can be taken care of. They can also be taken care of physical therapy and so forth. You don't need to take a lot of medications for that. However, just because we're reducing the fibromyalgia symptoms and evacuating fibromyalgia from your system does not mean that the osteoarthritis will go away. It's just not going to go away, along with many of the other things. So you may have to take medications. That's the time you look for the side effects. And that's one of the subjects I'm going to talk about. Melissa asked me a question. She sent in a question and asked about she had taken for years high doses of prednisone, and if that adversely affected fibromyalgia, or if it actually triggered fibromyalgia. But it really, in effect, when she came back, she actually said that she had fibromyalgia for years, and obviously it was in her system, and as I've mentioned to you, genetically it's in your system and it's triggered by something. So what about prednisone? Well, prednisone has a lot of side effects also, and many of them of which mimic fibromyalgia, such as headaches and skin problems, sleep disorders. But one big thing about prednisone is that it does affect your immune system. When your immune system is lowered or affected adversely, what happens is that you have your body's open for other conditions and other infections and so forth. So make sure that if you're going to take prednisone, and I've known it as an anti-inflammatory, and there are times in which certain conditions you have to take prednisone. Polymyalgia rheumatica is one of those. You just take small doses of prednisone for a short period of time, and literally your symptoms go away, and you don't have to take it again until maybe months or years later when it actually shows back up again. Polymyalgia rheumatica is not a bone or joint destructive disease. It just goes into either the shoulders or hips or knees, bilateral. That means both sides, left and right. You take a little prednisone, little injection here or there, or whatever they might give you, and bango. Lo and behold, many times it's gone within 24, 48 hours. So that's a nice way. You don't need to take high doses of prednisone. One of the adverse effects of high doses of prednisone, and I can only mention this because of a fact that I had a patient come in, and a poor lady, she was elderly, and she was about 90 pounds, and they put her on high doses of prednisone, and literally within 6 months, she literally blew up like a balloon. She came in, I didn't even recognize her. And so there is a weight problem, weight factor, oftentimes a weight increase because of that. So again, just to reiterate, we already talked about the other conditions, and that's why so many doctors have a difficult time diagnosing fibromyalgia, because they're intertwined with so many of these other conditions, okay? And so what we try to do is to make sure that the patient understands we're treating the fibromyalgia. The other symptoms of those other conditions should reduce, not totally disappear, especially if you do have severe cases of different conditions, but it should help at least your other doctors be able to treat these secondary conditions much more readily and make it easier for yourself. Cheryl, I hope I answered your question on adenosine triphosphate and as whether or not adenosine triphosphate, I think you mentioned treatment through magnesium would help. That's what we suggest. If it's injectables, great. If that's will reach your problem much more quickly. Keep in mind, magnesium has as I mentioned, has a maximum per day that you can get into your system without having any secondary side effects. Off the top of my head, I'm pretty sure it's 500 milligrams. And so how often you should get the injections? Well, many times, if you're going to have an injection, it goes right to the spot, right to an area or cellular in itself. You may have a very, very fast reaction. I would not. Well, you have to depend upon your own allopath as far as naturopath, whatever else, as far as whether or not they're going to give it to you. But I would slowly, on a irregular basis, shall we say, see what magnesium does. Magnesium, one of the main problems with magnesium is high levels of diarrhea, and you don't want to have a secondary condition to take care of another condition. Also, Jennifer, calcium supplements, would it exacerbate your symptoms? Right now, I would have to say that if you're starting out fibromyalgia, the protocol itself, the calcium supplements probably would not be the best because calcium does have a problem as far as one of the basic problems of excess calcium within the cells. So I would watch that very, very closely. Here's a question from Shelley. Do you work alongside the physician? Do you work alongside another physician or what? Well, there are other physicians that I can refer to for other conditions that are outside of my wheel of practice, so to speak, and so that's important. I'm not adverse to referring patients out for conditions that are beyond my scope of practice, and that's very, very important. Everybody understands. And there was also a question, let me just double check, about fish oil, having a hard time finding 100%. Yeah, there's so many different fish oil products out there, and it's really a problem. We use only 100% pure fish oil, which means that everything that a company does in the production of a certain product is completed, and then all the machinery and everything is sterilized before they start a secondary area of production for whatever product might be. Keep in mind, fish oil, the two important aspects are EPA and DHA. EPA, eicosapentaenoic acid, is the anti-inflammatory. DHA is docosahexaenoic acid, is for brain stimulation. It's wonderful. They're using it on autistic children, Alzheimer patients. It's great, but you have to take a minimum of 3,000 milligrams of EPA, 2,000 of the DHA, purified form. And I've mentioned this before. It takes 1,000 pounds of fish oil to produce 100 pounds of pure, unadulterated fish oil. They don't throw the other 900 pounds away. They grade them like A, B, C, D. Each level has a little bit less purity, a little bit less purity, a little bit less purity. So if you go into the store and you're getting 1,000 fish oil capsules for $15, chances are it's not pure, to be honest with you. And so look at the label and see what it has gone through, or ask me, and I'll tell you what companies that I know of that have purified fish oil. And let's see, what's the other thing about fish oil? Oh, I know. Okay, that's from fish, and then you have the secondary one from, let's see, what is it? Right off the top of my head, it's a variance of fish oil, but it doesn't have the EPA and DHA in it. And so it has to do with those little itty-bitty shrimp type fish. And the only tests that have been done thus far, I think I mentioned this before, have been those that produce the product. And so I would not just depend upon the secondary product for fish oil for your EPA and DHA production itself. So Let's see, anything else here? Anything else? I hope I answered all of your questions. And again, as we go along, if you have questions, feel free to send them in, and I'll answer them as they come across my screen. Again, thanks to each and every one of you. I'm trying to get back all of your information that you're requesting. Again, Cheryl and Jennifer and Melissa, I really appreciate your interest, and anything else that I might be able to do to help you, please let me know. Again, this is Dr. Ken Muich, Fibromyalgia Wellness Center. We're always glad to see you're back in other body parts. That's kind of an interesting thing I say, since I am also a doctor of chiropractic, and yet the protocol that we use is not dependent upon chiropractic. For secondary conditions like osteoarthritis, things of this sort, yeah, it's great, but the actual protocol is not chiropractic based. Thank you very, very much. Again, I will look forward to seeing each and every one of you, and hopefully all your friends, next week. It'll be, let's see, number 15. And so we'll cover another exciting subject. Sometimes I give them ahead of time, but other times it depends. Like this last week, I thought this was perfect because the patient came in, and I said, I better cover this, because I'll bet that if some of you are out there doing the protocol and you're still having problems, you're forgetting that you have another condition, and that condition has its own symptoms. Thank you very, very much. Lots of love, health, and happiness to each and every one of you. Bye-bye now.